My name is Jasmine Bush, and I'll be providing today IV push simulation with furosemide. And first, I'll start by verifying my doctor's order with my MAR. I'll be checking the patient's name and date of birth: Janet Green, birthday June 3rd, 1972. I'll be checking the medication, furosemide, the dosage, 30 milligrams, the route, IV push, and the time, every 8 hours. And I will be checking for allergies, and she does have an allergy to penicillin. Next, I'll take my medication, furosemide, and compare it to my MAR. This furosemide states that it's 40 milligrams per 4 milliliters. And the doctor order is furosemide 30 milligrams IV push every 8 hours. And I've already done my math. So I'll be giving 3 milliliters of furosemide. Next, I will come to my book and I'll make sure this is a safe dose. And it says that I can give 20 to 40 milligrams and it may be repeated over 2 hours. Next, I will be checking for the dilution, and it may be given undiluted. It's not usually added to IV solution, but large doses may be added to normal saline, lactatus ringers, D5W, and given as an infusion. And my patient in her room, she does have D5 running, therefore it is compatible because the book says so. The rate of administration will be each 40 milligrams or a fraction thereof will be given over 1 to 2 minutes. My patient will be getting it over 2 minutes because that is the safest for the patient. I'll be monitoring the patient's blood pressure, the kidney function, and potassium because furosemide is potassium wasting. And I'll also check her iron. Next, I'll gather my equipment for me drawing up my medication. I'll wash my hands first. I will clean vigorously for 15 seconds. Also, the expiration date on this medication is July 2020. I'll drop 3 milliliters of air to avoid any type of air bubbles. I'll then inject air. Then make sure I don't have any air bubbles. All right, this is 3 milliliters. Next, label my patient's medication with her name, Janet Green. She'll be receiving furosemide, 30 milligrams. And today's date is January 29th, 2020. The time is now 13:44. The expiration date is 7/20/21. So next I will gather my items, go to the patient's room with Tamar. I'll introduce myself. My name is Jasmine Bush, and I'll be your nurse today. And I will be giving you furosemide, 30 milligrams via IV push. Can you tell me your name and date of birth? And she tells me her name is Janet Green. Her date of birth is June 3rd, 1972. I will also ask her if she has any allergies, and she does. She's allergic to penicillin. I'll wash my hands. I'll assess her sight. But first, before I assess her sight, I'll give her education. You will be receiving furosemide because the doctor ordered it, and he said that you have too much fluid on your lower extremities. So this furosemide will pull it off. It will also lower your blood pressure because you'll be going to the restroom. So when you get up, try to call us so you don't fall. Make sure you have your skid-free socks on and the bed in its lowest position. So next I would check to make sure that I see blood return, making sure that the IV site is patent. I will lower it. Check to make sure that it is not swollen, that there's no redness, no pain. The patient states that there is no pain and she is comfortable. So I would wash my hands again. I'll find the port closest to the patient and I'll scrub the hub for 15 seconds. Okay. The patient will be given furosemide over 1 to 2 minutes. 2 minutes because it's the safest for this patient. All right. And then I'll clamp it. And give her one. Let it go for 1 full minute. All right, I'll clamp it. Let it run for another minute. Now clamp it one more time. I'll push the remaining. Let it run. All right. I remind my patient not to get up without calling me first, because this medication will drop her blood pressure and make her dizzy. She will fall and hurt herself. I'm disposing my equipment, checking to see if there's any redness, inflammation, any swelling, asking the patient, is she okay? And if the patient is okay, the bed is in its lowest position, and make sure she has her skid-free socks on. Thank you.